Assalamu alaikum wa rahmatullahi wa barakatuh. Today, our lecture about antimycobacterial drugs. Antimycobacterial is a type of drug used to treat mycobacterial infections, which include tuberculosis treatment, synthetic drugs and antibiotics, and also leprostatic agents. Chemotherapy of infections caused by Mycobacterium tuberculosis, Mycobacterium leprae, and Mycobacterium avium intracellular is complicated by numerous factors, include limited information about mechanism of action of drugs, the development of resistance which rapidly occur, intracellular location of mycobacterial, which is difficult to entrance of the drug, and also it is difficult to maintain concentration, adequate concentration intracellularly. The chronic nature of mycobacterial disease, which requires prolonged drug treatment and is association with the drug toxicity. When the drug used for long term period، يعني فترة العلاج اللي تحتاج على أقل تقدير هو 6 months، فلذلك ممكن يصير accumulation of drug and its metabolites which may cause toxicity, drug toxicity. Also, the long term of treatment may change or alter the patient compliance. يعني المريض يبدي يتضايق من أو يمل من أخذ الأدوية، فلذلك ممكن يغير الكومبلينس مالته، أو يعني مو يقطع أخذ الأدوية وإنما يكون بفترات متقطعة، أو لأنه يحس بنفسه تحسن فما يكمل العلاج، ما يكمل الفترة. A classification of anti-tuberculosis treatment. First line treatment, all first line anti-TB drug names have standard three and single letter abbreviation, such as ethambutol is EMB or E, and include isoniazid INH, pyrazinamide PZA and or Z, rifampicin RNP or R, streptomycin S. All other first-line anti-TB drugs are routinely used, given once a day, and they have high anti-TB efficacy with low toxicity in general. Even when the clinical improvement can occur, but the therapy is continued much longer to eradicate resistant organism or to prevent relapse. Standard short course chemotherapy for tuberculosis include isoniazid, rifampicin, ethambutol, and pyrazinamide for 2 months, followed by isoniazid and rifampicin for 4 months. Continuation phase. The second line drugs, which include antibiotics such as aminoglycosides, other rifampicin, such as rifabutine, rifabintine, some macrolides, azithromycin, clarithromycin, other antibiotics such as capreomycin and cycloserine. While synthetic drugs include fluoroquinolones such as ciprofloxacin, ethinomide, and para-aminosalicylic acid, linezolid, also linezolid. These drugs have no more effective than the first line agents. يعني مو فعاليتها أكثر من الفعالية first line drugs. And their toxicity are often more serious. لذلك هي second line لأنه due to their toxicity. They are active against atypical strains of mycobacteria. First line treatment, TB treatment, isoniazid. The INH is a prodrug activated by mycobacterial catalase peroxidase enzyme. Pharmacokinetic. INH is readily absorbed after oral administration. Absorption may impair with if taken with food, particularly high-fat meals. Distribution, drug distribution into all body fluids, cells and caseous materials اللي هي necrotic tissues and macrophages. So it is effective against intracellular and extracellular organisms. The drug concentration in cerebrospinal fluid are similar to that in the serum, يعني easily penetrate to blood to cerebrospinal fluid and can be used in treatment meningitis, TB, and CNS. Metabolism, isoniazid undergoes N-acetylation hydrolysis resulting in active metabolite. INH acetylation regulated genetically either fast acetylators اللي الهالف لايف مالته راح يصير about 90%, about 90 minutes, while the slow acetylator, the half-life of drugs about from 3 to 4 hours. Excretion, mainly through renal, excreted through renal, predominantly as metabolites, while slow acetylators excreted more than parent compound. Mechanism of action. Isoniazid is a prodrug activated by mycobacterial catalase peroxidase enzyme. INH targets the enzyme acyl carrier protein reductase and beta ketoacyl ACP synthetase, which are essential for synthesis of mycolic acid. المايكوليك acid وين موجود؟ بالcell wall أو cell bacterial cell wall. Inhibiting mycolic acid lead to disruption the bacterial cell wall. يصير عندنا disruption معناها change with the environment، يعني extracellular والintracellular يصير بيناتهم يعني حسب الأوزموتيك بريشر يصير بيناتهم تنقل مما يسبب بالنهاية إلى الرابتشر للسيل بكتيريال سيل. Antibacterial spectrum هو narrow INH narrow spectrum لأنه specific for treatment of mycobacterial tuberculosis. This drug, the drug is particularly effective against rapidly growing bacilli and also active against intracellular organs. In this figure, the entrance of INH will expose to metabolism or metabolic change through effect of katG enzyme اللي هو mycobacterial catalase peroxidase enzyme. فالميتابولايت هو راح يكون active metabolite which interfere with mycolic acid essential component of cell wall, interfere with synthesis of مايكوليك أسيد، لذلك راح يصير عندنا نقطة ضعف أو نقطة اللي بيها ما بيها المايكوليك أسيد، فيصير disruption بالسيرول اللي هي ممكن اختراقها، ممكن يصير التحام أو تساوي بين الإكسترا سيلولار والإنترا سيلولار. Mechanism of resistance. Resistance can emerge rapidly if a drug is used alone. Resistance can be due to either high level resistance is associated with a mutation مع طفرة أو deletion in the katG gene which involve in bioactivation of INH. يعني إذا صار عندي قلة أو mutation لهذا الجين المسؤول عن الميتابوليزم of INH، لأنه إذا ما يصير ميتابوليزم يبقى الدراج برودراج مثل ما قلنا يبقى ال INH غير فعال pharmacologically not active. Varying mutations of acyl carrier proteins or overexpression of target enzyme INH، يعني أما أن يكون الأسيل كارير بروتين أما يكون به ميوتيشن أو أنه كثرة مالته ممكن تعرقل عمل الميتابولايت active ميتابولايت. Cross resistance may occur between isoniazide and ethanamide. Clinical uses can be used for serious infections or if malabsorption is a problem. Also used twice weekly for serious dosing regimen in combination with a second anti-TB agent. Pyridoxine ممكن ينطي recommended for the those with condition predisposing to neuropathy مثل عندنا جماعة الديابيتس and adverse effect of isoniazide can be given parenterally in the same dose, or isoniazide as a single agent is also indicated for treatment of latent tuberculosis. Unwanted effect of INH. The most serious side effect of hepatotoxicity. The hepatotoxicity is the most serious adverse effect associated with isoniazide if hepatitis goes unrecognized، يعني إذا ما ممكن يعني ما تشخصت بالوقت المناسب أو إنه الisoniazide is continued for long term even when there is signs of hepatitis. This drug will or hepatotoxicity can be fatal. Peripheral neuropathy is in high dose. This can be prevented by prophylactic oral use of pyridoxine, vitamin C. High-risk patients are with the diabetes, alcoholism, chronic renal failure, and malnutrition. CNS toxicity, which is less common, include memory loss, psychosis, and seizure. This effect also may be respond to vitamin B6. Systemic lupus erythematosus-like syndrome may occur, but rarely, nausea and vomiting. Drug interactions. Aluminium salt decreases the absorption of INH by reducing or decreasing gastric emptying. Also, INH is known to inhibit the hepatic metabolism of drug that undergo oxidation including warfarin and valproic acid. فما دام يصير عندنا inhibition للميتابوليزم معناها انه الوارفارين والفالبيوريك acid راح يصير act for a long term. ممكن تطلع التوكسيسيتي مالتها، ممكن يصير عندنا مثلا bleeding due to high concentration of warfarin. Also, because isoniazide inhibits the metabolism of carbamazepine and phenytoin, isoniazide can potentiate the adverse effect of this drug, for example, nystagmus and ataxia. The second first line treatment اللي هو rifampicin. Rifamycins, a group of structurally similar macrocyclic antibiotics, which are the first-line oral agents of tuberculosis. Rifampin, rifabutine, and rifabintin. Rifampin is a semi-synthetic derivative of rifamycin, an antibiotic produced by Streptomyces mediterranean. In general, they are rifampicin bactericidal and has a wide spectrum, more than isoniazide. It has a broader antimicrobial activity than isoniazide. It's active against gram-positive, gram-negative cocci, some enteric bacteria, mycobacteria, and chlamydia. Mechanism of action. Rifampicin blocks RNA transcription by interacting with beta subunit of mycobacterial DNA-dependent RNA polymerase. Resistance. Resistance can be occurs to rifampin by mutations in affinity of bacterial DNA-dependent RNA polymerase gene for the drug. While human RNA polymerase does not bind to rifampin and is not inhibited by it. يعني هنا rifampicin very selective for mycobacterium, not to human cells or host cells. In this figure, shows that the site of action of first-line agents, isoniazide, act on myconic acid and cause destruction in the cell wall. Pyrazinamide act on cell membrane acidification, also change in its function. Rifampicin act on DNA dependent RNA polymerase، فايش راح يصير لنا especially البيتا سبيونت راح يصير عندنا destruction بال DNA ال RNA synthesis. Pharmacokinetic. It is readily penetrates most tissues and penetrates into phagocytic cells. Rifampin is well absorbed after oral administration and excreted mainly through the liver into bile. It undergoes enterohepatic recirculation with the bulk excreted and as a deacetylate metabolites in feces and a small amount excreted in urine. The half-life about 3 hours. About 90% of the drug is protein binding in plasma, and rifampin can induce hepatic cytochrome B450 enzymes and transporters, lead to numerous drug interaction, pharmacokinetic interaction. Unrelated to its effect on cytochrome B450, rifampin undergoes auto-induction, lead to shortening elimination half-life over the first 1 to 2 weeks of dosing. يعني ممكن انه مو بس يسوي induction other induction other metabolism to other drugs, also can induce metabolism. Auto induction can induce metabolism to itself. يعني الريفامبين يأثر حتى على الميتابوليزم مالته، ممكن يسوي induction للإتس ميتابوليزم، ولذلك راح تطلع عندنا loss of activity يعني shortening half life. Elimination of rifampin and its metabolite is primarily through the bile and into the feces. A small percentage is cleared in the urine. اكو فد نقطة مهمة أو ملاحظة مهمة، هو الurine feces and other secretions have an orange red color، وهاي كلش مهمة. So patient should be forewarned. Tears may even stain soft contact lenses orange red، يعني حتى العدسات ممكن تظهر عليها التلوين. Contraindications. First, hypersensitivity. Attended administration of live bacterial vaccines، يعني contraindicated when عندنا vaccines bacterial vaccines. Contraindicated in patient receiving sequanavir because of risk of severe hepatocellular toxicity. Also can be used with caution in patient with history of alcoholism or patient receiving additional medications that may cause hepatotoxicity. When rifampin has enzyme-inducing properties that can enhance metabolism of endogenous substrates، يعني مو بس الدراجز، أيضا عندنا endogenous compounds include adrenal hormones, thyroid hormones, and vitamin D. When they metabolize, they reduce the plasma concentration and possibly the efficacy of chloramphenicol, and oral sulfonylureas can be altered. يعني concentration can be reduced. إذا عندي هنا من نقول الانزيم induced راح يزيد لنا الميتابوليزم، والميتابوليزم راح يحول لي endogenous substances مثل adrenal hormone which is most important hormone, thyroid hormone اللي هي ممكن اللي هي تعمل على الميتابوليزم مال الميتابوليزم مال whole body. Also an effect on vitamin D ممكن تأثر على النورمال فيسيولوجي للهيومن body. Also ممكن تأثر على الاكسوجينس substances اللي هي chloramphenicol, oral sulfonylurea، أيضا ممكن يقل الإفيكاسي مالتها نتيجة induction of metabolic enzyme. Clinical uses: mycobacterial infection and can given with isoniazid and other anti-tuberculosis drugs. Effective in combination with other drugs in some atypical mycobacterial infections, and also used in leprosy. Unwanted effects of rifampicin: first, hepatotoxicity, which is a transient rise of transaminases in plasma, induction of drug metabolism enzymes in liver, so it's inactivated oral contraceptives, phenytoin, warfarin, and sulfonylurea. Some influenza-like symptoms, flashing rashes, urine and tears become pink red, which may be useful guide to compliance. يعني ممكن الطبيب يعرف إنه المريض جاي ياخذ مستمر على منتظم على أخذ الأدوية لو انقطع عنها من اللون إذا كانت موجودة even in tears، يعني السلايفة tears هاي إذا موجود هذا اللون البينك ريد معناها إنه مستمر بالعلاج المريض. Ethambutol, first, it's bacteriostatic and specific for most strains of mycobacteriosis, mycobacterial tuberculosis, and mycobacterial cancer has essentially replaced salicylic acid because of lower incidence of toxic effects and better acceptance by patients. يعني الإيثامبيوتول ممكن يتقبل المريض أكثر من الأمينو ساليسيليك أسيد. إضافة إلى الانسيدنس of toxic effects. Lower incidence of toxic effects. The mechanism of action inhibits the synthesis of arabinogalactan, which is essential component of mycobacterial cell wall. By inhibition of mycobacterial arabinosyl transferase enzymes, which are involved in polymerization reaction of arabinoglycan. Resistance to ethambutol is due to mutation results in overexpression of ethambutol gene. Kinetic, well absorbed from GIT, across blood-brain barrier only when meninges are inflamed. Ethambutol hydrochloride usually given as a single daily dose in combination with isoniazid and rifampin. A higher dose is recommended for treatment of tuberculosis meningitis. Adverse effect. The most important adverse effect is reversible optic neuritis, resulting in diminished visual acuity and loss of ability to discriminate between red and green. Visual acuity and color discrimination should be tested prior to initiation therapy and periodically thereafter. مش مهمة الفيزوال اكيوتي ويا الايثامبيوتول لانه الاوبتيك نيورايتس راح تصير عندنا التهاب بالاعصاب وايضا عندنا يجب انه يكون الفحص قبل بالعلاج والفحص بعد العلاج حتى دائما نتاكد من سلامه النظر. Exacerbation of gout يعني second or third adverse effect exacerbation of gout. Urate excretion is decreased. راح يحافظ لنا على يخزن اليوريك acid واليوريت فلذلك راح يصير عندنا precipitate of gout. Contraindication in children too young to permit assessment of visual acuity and red-green color discrimination. Acute gout or hyperuricemia, abdominal pain, anaphylaxis, confusion, disorientation, fever, headache, liver function test, abnormalities, and nausea. Pyrazinamide is a synthetic anti-tuberculosis agent, orally effective short course agents used in combination with isoniazid, rifampin, and ethambutol. Relative of nicotinamide, effective against intracellular organism in macrophage, where the pH is low. لأن عندنا البيرازيناميد مهم إنه يكون ال pH low فلذلك يشتغل intracellularly بالماكروفيج. Pyrazinamide mechanism of action. Pyrazinamide is converted to pyrazinoic acid, the active form of the drug. يعني عندنا البيرازينويك acid هو الactive form pharmacologically active metabolite. By mycobacterium pyrazinamidase enzyme. pyrazinoic acid disrupt mycobacterial cell wall membrane metabolism and transport functions. إذا عندي briefly pyrazinamide through the enzyme pyrazinamidase enzyme يتحول converted to pyrazinoic acid. Pyrazinoic acid اللي هو pharmacologically active substance راح تسوي لنا disruption or alter change the mycobacterial cell membrane. فالمايكوبكتيريال سيل ممبرين الميتابوليزم اند ترانسبورت فانكشن، يعني التو فانكشنز، الميتابوليزم للمواد اللي تصير بيها بالسيل ممبرين، وعندي also الترانسبورت فانكشن اللي هو responsible for control transport ions and substance between intracellular and extracellular، فراح يصير بيها disruption. But the precise mechanism of action is unclear. Resistance may be due to either impaired uptake of pyrazinamide or maybe mutation in PNC A gene encoding اللي هو pyrazinamidase nicotinamidase. فلذلك راح يصير عندي خلل اما الريزيستنس ممكن تكون اما انه خلل بالابتيك اوف بيرازيناميد، يعني ما يدخل داخل البكتيريال مايكوبكتيريال سيلز، او نتيجه هو الميوتيشن، الطفره اللي تحدث بالجين المسؤول عن تكوين البيرازيناميدز ديز نيكوتيناميديز انزيمز. Clinical uses. BZA is an important frontline or first-line drug used in conjugation with isoniazid rifampin in short course. I mean 6 months regimens as a sterilizing agent active against residual intracellular organism that may cause relapse. ممكن يمنع لنا الريلابس مالت يعني البكتيريا المايكوبكتيريا اللي تبقى خامله، ممكن انه نستخدم البيرازيناميد حتى خلال هاي الفتره كل الكامله ممكن يقتلها الانتراسيلولاري. Adverse effect. BZA is associated with dose-related hepatotoxicity، يعني dose-related كل ما يكون عدة زيادة بالدوز كل ما يكون عندنا الانسيدنت of hepatotoxicity is high. GIT disturbances, hyperuricemia, uric acid retention is common but rarely precipitate a gouty attack. Arthrialgia, streptomycin. An-aminoglycoside antibiotics was one of the first effective agents for TB. Streptomycin penetrates into cells purely and is active mainly against extracellular TB tubercle bacilli. Non-tuberculosis specific species of mycobacteria other than Mycobacterium avium complex and Mycobacterium cannasazi are resistant. Mechanism of drug action. First, it's bactericidal, irreversible, inhibit bacterial protein synthesis. يعني هو أصلاً هو من جماعة الأمينوغلايكوسايدز. Pharmacokinetic, poorly absorbed from GIT, given IM intramuscular. Streptomycin crosses blood-brain barrier and has achieved therapeutic concentration with inflamed meninges. The side effect, streptomycin side effect of streptomycin is ototoxic and nephrotoxic. اللي هو similar to that occurs in all aminoglycosides. Thank you. Thank you for all, and this is the first part of antimicrobacterial drugs.